Well, in 2009, which is the latest data we have, about 9% of older adults age 65 and older were living in poverty. That's about 3.4 million people. But it's important to keep in mind that another quarter of older adults were living in low-income families. That means their incomes were 2 times the poverty level. So if you combine the two, those living in poverty and those in low-income families, we're talking about 1/3 of older adults, or 12.8 million people, have low incomes when they're over 65. There are numerous factors. First, older women are much more likely to be poor than men, and that really results from 2 primary factors. One is that they live a lot longer than men, and 2 is that they typically have earned less during their working careers than men and have saved less for retirement. So for example, married women, if they outlive their spouses, typically their incomes drop considerably when their spouse passes away. So poverty is a real issue for widows and for divorced women especially. Also, low educations help to explain who's living in poverty in old age. When you have limited education, you tend to be earning less during your working career and have a very difficult time saving for retirement outside of your Social Security that's taken out of your check. Minorities, much more likely to be poor than whites, African Americans, Hispanics, even Asians. Their poverty rates are all higher than it is for whites. And in fact, African Americans and Hispanic older adults, 19% are poor. That's double the rate for the average older adult population. And about half of them are living in low-income families. So it's a real problem for minorities, for single women, and for those with low educations who haven't been able to save for retirement. It's widely agreed that the official poverty measure is woefully out of date. It is based on expenses that were observed back in the mid-1960s. And back then, the thresholds were set lower for older adults than they were for adults under age 65. And we know today that expenses have changed dramatically among families. Also, the official poverty measure fails to include some important sources of income, such as food assistance and housing assistance, and it fails to take into account necessary expenses, such as out-of-pocket health spending, which is a very big issue for older adults. So when you combine those factors, necessary expenses, especially health care for older adults, you get a much higher poverty rate and a much more realistic picture of whether older adults are able to meet their basic needs. About 15% of older adults get some help from the Supplemental Nutrition Assistance Program called SNAP. This was formerly called food stamps. And that's about 15% of the population. And another 5% of the more frail population get some help from the Meals on Wheels program. That's about 880,000 older adults. But despite this kind of help that they are getting, estimates show that only 1/3 of older adults who are eligible for SNAP benefits, for example, actually get those benefits. And there are a lot of reasons why we think that older adults are less likely to participate. It can be stigma, it can be lack of knowledge about the program and how to apply. It can be difficulties applying. If you're frail and it's harder for you to get out of your house, it's harder for you to apply for something like that, government assistance. So we also see that a lot of older adults go to food banks, a lot of poor older adults go to food banks to supplement their incomes. I think there's a danger in that common wisdom is that older adults are okay because they have Social Security, they have Medicare. But I think the data we just talked about shows that there's really a big swath of the older population that we need to care deeply about their incomes. And any changes to Social Security and Medicare really need to bear in mind that there is a large, as we said, 12 million people who are having trouble making ends meet and really have to be looked out for when we revise those programs.